Hi everyone, welcome back. We're going to continue our USMLE series on cellular adaptation. Today we'll be talking about metaplasia. So let's start with a question. 55-year-old man with history of chronic gastroesophageal reflux disease presents for evaluation. He underwent endoscopy that shows salmon-colored mucosa in the distal esophagus. Biopsy reveals intestinal type columnar epithelia with goblet cells. What type of epithelial change is this? So the answer to this question is going to be metaplasia. So let's see why. So metaplasia is the cellular adaptation that results in the reversible replacement of the cell by other cell that can tolerate the stressor very well. So the key word here is replacement of one cell by another cell, which is reversible. Metaplasia often carries the risk of dysplasia, and hence it can lead to cancer. So let's look at the mechanism of this metaplasia. So the stress, so there's a stress on the cell, and that stress causes gene activation that causes reprogramming of the stem cells. So very importantly, reprogramming of those stem cells. So let's look at some examples. So we're going to start with glandular metaplasia. So under glandular metaplasia, we have Barrett esophagus. So Barrett esophagus, so in the esophagus, the lower part of the esophagus, as you can see in this picture, is connected to the stomach. So if somebody have too much of relaxation in the lower esophageal sphincter, then the acid in the stomach could be refluxing into the lower part of the esophagus. And that could change the epithelia in the lower part of the esophagus from non-keratinizing squamous epithelia, and it can change it to non-ciliated mucin-producing columnar cells due to the acid reflux. And the one thing I need to mention is whenever you change from one epithelia to another epithelia, the new epithelia is going to be the name of the metaplasia. So a classic example is here, we're changing from squamous epithelia, we're changing from squamous to a glandular epithelia. So now the name is going to be glandular metaplasia. And of course, this also carries the risk of dysplasia, and this can lead to adenocarcinoma of the esophagus. Moving on to the next example, which happened in the stomach, which is chronic gastritis due to Helicobacter pylori. So this causes replacement of the gastric glandular epithelia by intestinal glandular epithelia. And how do I know that this is an intestinal epithelia? Because I see a lot of goblet cells in it. And this occurs in the pylorus or the antrum of the stomach. And this can lead to dysplasia, and then from dysplasia, it can lead to adenocarcinoma of the stomach. Moving on to the next example, which is where we change from one epithelia to squamous. So we're going to call this squamous metaplasia. So the first example there is bronchial squamous metaplasia. So this occurs in people who smoke, who are exposed to smoking. So exposure of the bronchus to smoking that changes the pseudostratified columnar epithelia to squamous. So the pseudostratified columnar epithelia is changed to squamous. And this can increase the risk for the patient for infection because the pseudostratified columnar epithelia are usually ciliated, and that helps with clearance of mucus. And if that's impaired because it has changed to squamous, that will increase the risk of infection. And then likewise, this patient also increases for bronchial squamous cell carcinoma because of risk of dysplasia and ultimately leading to squamous cell carcinoma. Next is urinary bladder squamous metaplasia. So the urinary system is lined by transitional epithelia. If there is exposure to infection like schistosoma hematobium, this could change the epithelia from transitional cell into squamous cell, and that could lead to dysplasia, and this patient could be increased risk for squamous cell carcinoma of the urinary bladder. Moving on to the next example, which is conjunctival squamous metaplasia. So this is seen in patients who have vitamin A deficiency, and this leads to replacement of the thin squamous lining of the conjunctiva by stratified keratinizing squamous epithelia due to vitamin A deficiency. Moving on to the next example, uterine endocervix squamous metaplasia due to the changes in the pH, which normally line by simple columnar epithelia. So this simple columnar epithelia is being changed to squamous epithelia, and of course this carries the risk of dysplasia, and this could lead to squamous cell carcinoma of the endocervix. Moving on to the last example under squamous metaplasia. So this is gallbladder squamous metaplasia due to chronic inflammation as a result of chronic cholecystitis, and that changed the normal epithelia of the gallbladder, which is simple columnar epithelia, into squamous, and that will also carry the risk of dysplasia, which can lead to cancer. Moving on to the last group of example, which is mesenchymal metaplasia. So under mesenchymal metaplasia, we have myositis ossificans. So myositis ossificans, so from the name, there's inflammation of the muscle and ossification, meaning that it's being replaced by bone. So this is replacement of muscle by bone due to muscle injury. And of course, it's important to mention that no risk of developing cancer in this particular metaplasia. Moving on to the next one, which is Mockenberg. So Mockenberg arteriosclerosis. So here, this is where the medial part of the blood vessel, the smooth muscle in the medial part of the blood vessel, is being replaced by calcium. So there's medial calcification of the arterial wall. And then usually this does not cause obstruction to the blood flow, especially if it doesn't involve if the intima is not involved. Remember, as opposed to the case of arteriosclerosis, whereby you form arterioma, so that will affect the flow. Next is calcification of the uterine fibroid. It's also another example of mesenchyma, metaplasia, whereby those smooth muscles are being replaced by are being calcified. And the last example there is tracheobronchopathia osteochondroplastica, whereby this is due to the replacement of submucosal cartilaginous by osteosis nodules in the respiratory tree. So that's all the example we have. So now let's go through some questions just to test what we've learned today. So the first question there is, which of the following best describe the mechanism underlying metaplasia? So looking through this option, so the best answer there will be C. So reprogramming of tissue stem cells to produce a different mature cells. And this is usually genetic reprogramming of the stem cell, and it's not a direct transformation of one mature cell into another. So it's actually a reprogramming. Moving on to the next question. 52-year-old man with chronic gastroesophageal reflux disease undergoes endoscopy showing Barrett esophagus. Which of the following malignancy is he at greatest risk for developing? So like we mentioned, with Barrett esophagus, right, it's a form of glandular metaplasia, and that will lead to dysplasia, and that will increase the risk of adenocarcinoma of the esophagus. So Barrett esophagus, which is a form of intestinal metaplasia, leading to dysplasia, and that will lead to adenocarcinoma of the lower part of the esophagus. So we have come to the end of today's video. Don't forget to subscribe to our YouTube channel and follow us on our social media platform, and I will see you in the next video. Thank you.